Concerns about the spread of West Nile virus in the United States. The West Nile virus, an arbovirus primarily transmitted through mosquito bites, has become a significant public health concern in the United States. According to the latest data from the Centers for Disease Control and Prevention, the virus has spread to 33 states, with 216 cases reported this year alone. Notably, 142 of these cases involved neuroinvasive disease, a serious illness that affects the nervous system and can have fatal consequences. The resurgence of West Nile virus cases in the late summer months, particularly August and September, has prompted public health agencies to step up their response. These months are often referred to as peak transmission periods and coincide with increased mosquito activity, which increases the risk of infection in humans. The virus, which is primarily transmitted by Culex mosquitoes, poses a threat not only because of its ability to cause severe neurological disease, but also because of the challenges of controlling its vector populations. Since West Nile virus was first detected in the United States in 1999, the virus has exhibited a concerning pattern of seasonal outbreaks. Initially confined to the Middle East, Africa, and parts of Europe, the virus suddenly entered the Western Hemisphere and quickly became a recurring public health threat. The epidemiology of the disease in the United States is characterized by its wide geographic distribution and outbreaks of varying severity. The Centers for Disease Control and Prevention reports that approximately 80% of people infected with West Nile virus have no symptoms and never realize they have the virus. However, approximately 20% of those infected develop West Nile fever, an illness with symptoms that include fever, headache, fatigue, and muscle aches. These symptoms typically resolve within a few days to a few weeks, but recovery may be prolonged, especially for those who become more severely ill. The most concerning aspect of West Nile virus is that it can cause neuroinvasive disease, which occurs in less than 1% of those infected. Severe manifestations of the virus can result in illnesses such as encephalitis, meningitis, or acute flaccid paralysis. Neuroinvasive West Nile virus is associated with high morbidity and mortality, especially among the elderly and immunocompromised. According to the Centers for Disease Control and Prevention, approximately 10% of people infected with neuroinvasive West Nile virus die from the disease. In the United States, the primary vector of West Nile virus is the Culex mosquito, which is well adapted to urban and suburban environments where humans live. These mosquitoes thrive in stagnant water and are often found in discarded tires, clogged drains, and unattended swimming pools. These breeding sites are widespread in densely populated areas, facilitating the virus's transmission cycle and making it difficult to control outbreaks. Mosquitoes become infected with West Nile virus when they feed on birds that carry the virus in their blood. Once infected, mosquitoes can transmit the virus to humans and other animals through their bites. The transmission cycle is further complicated by the ability of the virus to overwinter in mosquitoes, allowing it to persist in the environment and pose a risk for future outbreaks. Given the ongoing threat of West Nile virus, public health agencies emphasize the importance of taking precautions to protect individuals from mosquito bites. The use of insect repellents containing DEET, picaridin, or oil of lemon eucalyptus is strongly recommended, especially in the early morning and evening when mosquito activity is most active. In addition, wearing long sleeves and pants, using mosquito nets, and ensuring that door and window screens are intact can help reduce the risk of exposure. Community interventions are also critical to controlling the spread of the virus. Local governments have stepped up mosquito control efforts, especially during peak transmission periods. These efforts include targeted spraying of insecticides in areas with high mosquito activity and public awareness campaigns to encourage residents to remove standing water around their homes.